I take this opportunity to welcome all of you, my viewers, to our webpage or our YouTube, Love for Bookwa YouTube or loveforbookwa.com website. We are here for you. We are here so we can talk together about your health and make sure that you are living quality life that God has purposed for you, and you live it to its best. So we're going to talk about a number of things today. We are going to focus on hypertension. Hypertension is what we call here pressure. People say, I have pressure. And so what is pressure? And how do you know you have pressure? Those are the things we're going to talk about, okay? So today in this short video, I want to talk to you about the symptoms of blood pressure, complications, risk factors, prevention, screening and diagnosis, treatment, and management of pressure. So I want you to pay attention to every single slide, because every single slide makes a lot of sense if you pay attention to it. Now, we say high blood pressure, hypertension, or pressure is a silent killer. Why do we call it a silent killer? Because you don't even realize that you have it until the complications are already here, until it has already killed or damage something within your body, okay? And several things happen. We'll talk about the complications later, but how do you know you have it? Headaches. The headaches are so frequent. You take medicine, the headache comes back. You take medicine, you drink lots of water, the headache comes back. You go to the clinic, they give you Safe, they give you gentamicin, they give you Trap, everything that they give you, treating it as malaria, treating it as anything typhoid, but you still get headaches, pounding headaches that don't go away, okay? Chest pain, you just feel chest pain or chest pressure. Sometimes it's not like a real headache, but you feel like there's something sitting on your chest. Okay? It may come and go. Sometimes it comes when you're walking or when you're climbing up the stairs. And so those are some of the signs. Dizziness, you want to walk, you feel dizzy. We call it kisungusungu. Difficulty in breathing or shortness of breath, vomiting, fatigue, or just the body is just paining, aches in your body. Your vision can change, kind of blood vision. You try to see or something like that, anxiety, and many other things. So some of these things may be warning signs of hypertension or high blood pressure. So what happens when you get high blood pressure? What happens? How do you know you have it if you've even not paid attention to the symptoms? And by the time maybe you know that you have high blood pressure, you have already some of these complications. And we're going to talk about a few of the complications. One of them is heart attack or stroke. People can have stroke from nowhere. They say they had nothing, they worked well, or they were in the farm, they slept, they didn't wake up. All of a sudden, they were sitting down, they fell, and they stroked out. It means they have had blood pressure for a very long time, and finally, it has shown a complication with a heart attack or stroke. And it's very serious because sometimes we are not even able to reverse or to treat you enough to overcome the deficits that you get with stroke or a heart attack, okay? Sometimes you may have heart failure. Your heart is not beating well. The heart is supposed to be squeezing blood from the heart to the body. And so sometimes the heart becomes so hardened that it can't even squeeze blood. And eventually it just becomes big and bulging, and it really can't squeeze blood out, okay? So you have heart failure. It's not working the way it's supposed to be. Kidney failure. So it affects your kidneys, and therefore you might even end up needing dialysis. You can have dementia. Dementia is forgetting things. You put a pen there, you forget you had a pen. You even forget your spouse. You even forget your children. You forget you were going to the market and you turn around, go to the river. You forget you are going to sleep and now you're going to start the fire. So several things happen, and it can even lead to death. So hypertension is a serious disease. We need you to pay attention to the symptoms and its risk factors so we can prevent death or prevent complications altogether. Okay, what are some of the risk factors? Some of the risk factors, the biggest one is age. So the blood pressure, chances of getting blood pressure increase with age. 45, 50, 60, 70. So as the age increases, the chances of being diagnosed with blood pressure increases. Family history. Let's say your grandfather had high blood pressure, your grandmother had blood pressure, your father or your mom has blood pressure. It increases the chances that you will be diagnosed or you may be diagnosed with high blood pressure. Obesity, your weight. So pay attention to the things you eat and what you do, because obesity increases the chances. Sedentary lifestyle. You don't walk, you don't do anything. Sometimes when we have a little bit of money in our pockets and we buy a vehicle or we buy a motorcycle, we don't walk anymore. We don't go to the garden anymore. We don't do nothing. We have people working for us and therefore we don't do nothing. It's called sedentary lifestyle. It increases your chances of developing hypertension. Okay, tobacco use, whether it's chewed tobacco or smoking a cigarette, alcohol use, either busa, changa, beer, wine, alcohol increases chances. Too much salt. Maybe every time when people eat or when they cook food, everybody is comfortable with the salt that has been given, but you are not. You always will say, add for me a little bit of salt. Low potassium levels. This is a big one. There is no way you can know by yourself at home that you have low potassium levels. This is a chance you need to be testing yourself. Go for a checkup. They will check your electrolytes. Extreme ends of any spectrum are not good. So very low potassium or very high potassium levels are not good for you. So you need to be tested. Thyroid problems. Some people have grown goiter, which is big, but their levels are normal. You may have nothing showing, no grown goiter, no enlarged glands, but your levels may be messed up, and that can predispose you to hypertension. Medicine, cough medicine. The medicine that we just take for cough, it has some substances that can predispose or put you into high blood pressure issues. Birth control, the tablets that we take, the injections that we take to prevent pregnancy, those hormones that are in it can predispose you to hypertension. I want to tell you one more time, birth control, especially things like Depo-Provera, use it for 2 years. After 2 years, the injectable medicine for birth control, take a break before you come back to it. Other medicines include ibuprofen, Motrin, Advil. That class of medicine can predispose you. And another one that none of us can avoid is stress. We all have stresses of all levels. The rich have stress, the poor have stress, and in between, everybody has their own stress. Let's try to manage stress because it can predispose you to hypertension. Now, how do we prevent? How do we prevent? How do we take care of ourselves so we don't end up with hypertension? Be physically active. Walk. Go to the shamba. Walk. If you are not too far, don't drive direct to the office and back to the shop and straight home. Take a chance where you walk. Even if you have a motorcycle, walk. Go to the garden. Do things. Cut the grass in your compound. Cut some trees. Plant your vegetables. Be active. Play games if you need to. Okay? Eat a balanced diet. More fruits, vegetables, and do not eat a lot of carbohydrates. We eat a lot of bread, a lot of ugali. All that is plain carbohydrates. Eat things that are good for you. Avocados, bananas, things, pineapples. Eat other things. Now, the tradition we have is you eat little vegetables, you eat more ugali. Now, in this slide, I'm going to reverse that. Eat more vegetables, less ugali. Okay, does that make sense? More vegetables, less ugali. Limit the amount of alcohol. Some people may enjoy socially drinking, but limit that amount. Okay, avoid tobacco. Tobacco is not good for you at any cost. And let me tell you one thing, it's very hard. I totally understand. If you've smoked or chewed tobacco for all your life, and now all of a sudden, Dr. Sabay tells you stop, it's not easy. I know it. Come to us, we will work with you. We have some gum that we can give you. We can give you a patch that helps you, nicotine patch that can help you withdraw and come out of alcohol. Okay, maintain a healthy weight and do other things that and reduce the amount of sugar of salt. We've talked about salt has a predisposer, so try to reduce the amount of salt. Now, what do we do? How do we know? You need to be screened. You need to go see your provider, see your doctor, see your clinician, not in the small clinics, but go to a place where they can actually screen you. Get regular blood pressure checks. Okay? Especially if you are over the age of 40, make sure that you get frequent blood pressure checks. Hypertension is diagnosed through taking blood pressure multiple times. So you may come in today and I tell you it's normal, but you need to do it over and over. So normally if you come to me and your blood pressure is high, I am required to take it for 3 times, different dates, different times, for me to actually say you have hypertension. However, if your blood pressure is above some particular levels, I can diagnose you with one blood pressure check that you have hypertension. Okay, so you need to be screened. Screening is actually cheaper or can even be for free compared to when you wait until your kidneys, your heart, your eyes have suffered. Okay, we have some things that you may want to see. Normal blood pressure. Okay, a normal blood pressure, depending on the age, there is actually not a specific normal for everybody, but we're just talking about textable one or the ones that have been a lot of research have been done and they have agreed upon. So if you have a blood pressure of below 130 of 130 over 85 and below, it's kind of normal or optimal for most people. High blood pressure will start from 130 to 139 over 85 to 89. Okay. Mild hypertension is from 140 to 159 over 90 to 99. Now, moderate high blood pressure is from 160 to 179 over 100 over 109. Okay. And above that, we have what we call hypertensive emergency. Hypertensive emergency. And so for those hypertensive emergencies, you actually need to go to the hospital so they can give you IV medication and monitor you very closely. Okay, so don't wait until you get to the orange or to the red areas. Go get screened when you are still within the green or the yellow areas. Okay, treatment. How do we treat? Some of the times we will have to go for medications, but in most cases, this is what we want to encourage you. You can actually control this by eating well, increasing vegetables and fruits, and decreasing a lot of carbohydrates. Doing exercise, decrease the amount of alcohol, avoid tobacco, and moderate and regulate your stress levels. Okay, and you will be at a good place. If you have any questions again, you'll be more than happy to we are more than happy to discuss more with you. So getting care at L4BH, we do screenings, and blood pressure screening for us is for free. Just walk in and say, all I need is to do my blood pressure, and the nurses at the front will do it for you, and you walk away. You can choose either to see the doctor or just to take those results anywhere. If you have already been diagnosed with high blood pressure, you are on medicine, and you regularly just want to check your blood pressure, just walk in here. We will not charge you to check your blood pressure, and you are on your way. We plan lifestyle changes. Increase exercise, decrease sedentary lifestyle, decrease the amount of salt, decrease alcohol, avoid stress, and many other things. And even the medications that you take can actually predispose you to blood pressure. So if you take lots of antibiotics once, that clog your kidneys and that block your kidneys from functioning, your kidneys will not be able to release the water that is in your body. And so the volume, it will be so high in your body that will throw you into hypertension. So be careful on what